Hello, this is Dr. Irene Hausinger, and today we will be going over the assessment form. This is a form that I am using with permission from Pierce County Alliance, Thurston County Drug Court, and DUI Drug Court programs. Most assessments that you will come across, probably 90% or so, unless there's an insurance company that's doing their own thing, will be ASAM, the American Society of Addiction Medicine. And the dimensions are going to be the same, but what is within the dimensions might change a little bit in terms of questions based off of the population. So, for example, if you are at an agency that's primarily working with LGBTQ, the questions are going to be geared towards that population. This is drug court, so you're going to see that the questions are geared towards drug court participants, whereas if you're at a general intensive inpatient or outpatient facility or inpatient, medical, etc., the forms might be a little bit more general, but they will get more specific depending on the population. So here we have the individual name and the date and then the signature, and this is a statement saying that they are voluntarily consenting to the assessment. We have your basic demographic information here and who is the person who is assessing. And where is it being assessed? Sometimes assessments might occur within a jail or prison setting or a school setting, depending again on the demographic that your agency serves. So we start here right away with dimension 1, which is withdrawal potential, and we go substance by substance. Okay, so it must meet all 4 criteria in order to be considered withdrawal. So stopping or reducing alcohol that's been heavy and prolonged, and then 2 or more of the following, which are the withdrawal symptoms. The sign or symptoms in criterion B cause clinically significant distress or impairment. The signs or symptoms are not attributable due to any other medical condition and are not better explained by another medical disorder, including intoxication or withdrawal from another substance. So we do each substance individually. So if you have all 4 of those, then you have withdrawal, which is one of the 11 DSM-5 criteria. If not, then we put here. So sometimes we might write in the date of their last use. Okay, so we're going to do this for every single substance. So we have stimulants, all your main stimulants, nicotine, opioids, sedatives, so those are like your benzos, caffeine, cannabis. Okay, and then this is more about, have you had a history of withdrawal? So anything here with a star is one of the 11 diagnostic criteria. So this is nice that this particular form does this for you. Not all forms do that, but this is a good, it draws your eye in so that you know that you can go back and count what the answers are to the stars. Okay. And then we give a risk rating and a recommended level of care. What's important here is that we summarize the clinical impressions and the supportive evidence and the individual strengths, and you can use the clinical language right here. You can also use quotes from the clients, and then what do they need? Do they need a referral to detox? If the withdrawal symptoms are not life-threatening, maybe they can get it in an outpatient type cocktail from their primary care provider. Okay. So we don't want, it wouldn't make sense for risk level 4 and then no immediate detox services, right? So it should be in line with it, but it doesn't have to be like 001122, right? It might be a little bit different. So you just need to really look at the wording here. Okay, great. Okay, so dimension 2 are biomedical conditions and complications. So basically it's a medical history, and you are checking, you just go through the list, and then if it's been treated or untreated, and if they have allergies, and then pregnant or parenting, children, etc. Okay. Have these or any other medical conditions been impacted by your use of alcohol or drugs? Have you continued to use the substance despite knowing it has caused or worsened a medical condition? Okay, that's actually criteria as well. Have you had any surgeries? So again, medical history, and here's a criteria. Have you had medical or dental conditions resulting from or being impacted by alcohol or other drug use? Do you have access to medical care? Do you have immediate medical needs? Okay, so remember, this is a holistic assessment. Are you taking any prescription medications? Sometimes this will say, are you taking it as prescribed? So we also want to know what the dose is, and then are they taking the correct dose? Are they mixing it with other things? Okay. Outside of withdrawal, are there other things that you need to have addressed? How would you describe your health? And then how does the counselor describe the health? And do these match? So sometimes the assessment form is done in two parts where the client fills out this part, and then the counselor will go in and ask them questions. So it kind of depends, again, on how the agency is structured. So once more, we have the risk ratings here, from incapacitated to no biomedical signs or symptoms are present. Okay, and then we have our levels of care down here. Okay. And you can't leave this blank. You have to put in what's the clinical impression, supportive evidence, patient strength. So you can put in quotes here. And then what do they need? Do they need a referral, etc.? Or maybe they don't need a referral. Dimension 3 are our emotional, behavioral, cognitive conditions and complications. And I like to let clients know that this is a more sensitive part of the assessment. So here we talk about physical harm and self-harm, and if you've received help for it or not. This is, and I like the wording here, can you share with me when you were a child or as an adult if anyone has taken advantage of you sexually or against your will? If yes, by whom? Have you received or participated in counseling? And if yes, what was the outcome? Have you ever been the victim of mental or emotional abuse? Same thing. So pay attention to the wording of these. Oh, and here, look, in the footer, star denotes symptoms that may be a DSM-5 criterion for substance use disorder. Do you have children? Can you tell me how your chemical use and criminal behavior has affected your relationship with them? Tell me if and when you've ever lost custody or temporary care of your children. So again, the wording here is very compassionate. What feelings did you experience if you were labeled or felt you were a bad parent due to your chemical or criminal behavior? Describe to me if you've ever felt discriminated against or exploited as a result of your cultural heritage, gender, sexual orientation, physical appearance, or age. So here we're getting a clear picture of the patient in a holistic and compassionate manner. Here we have another criteria. Please tell me when and how your alcohol drug use behavior caused problems for yourself and or others. Describe any significant losses that have caused you stress. Grief and loss is absolutely huge, and perhaps it's one of the reasons why people keep using. Tell me about any educational limitations you felt you have had that impacted your ability to succeed. So things like dyslexia or being left behind, ADD, ADHD. And here we have a suicide assessment. Are you currently experiencing any of the following? Can you tell me more? What are your current thoughts about suicide? One of the important things to note here is that everybody thinks about suicide. It doesn't necessarily mean that you are suicidal. And so sometimes clients are afraid to answer this question because I think, as human mortal beings, it's natural for us to think about, well, what if I wasn't here? In French, there is a phrase called l'appel du vide, which means the call of the void, and that can be described as you're driving along and there's a cliff, and momentarily you have a flash of thought that says, what if I drove my car over the cliff? You're not intending to do that. You're just wondering. And then you think that for a split second, and then you go back to reality and driving your car. So that doesn't mean that you're suicidal. So sometimes you might want to have a conversation and just clarify this for your clients. Okay. Is there any history of suicide or suicide attempts in your family? There is evidence to support that if there has been a suicide, there's more vulnerability and a much higher rate of future suicide. So for example, if a parent has completed suicide, the child is at a much higher rate of completing suicide. If a sibling has completed suicide, other family members might be at a higher rate as well. Have you ever attempted? Do you currently have a plan to harm yourself? And we know It's much more serious if the person does have a plan. Most suicide completions are accidents. Um, and in only 10 to 20% of cases is there an actual note that is left. All right, and then you give them a risk from low to high. And if it's high, do we have a self-harm prevention contract? Okay. We have behavioral conditions and complications. Have you had any homicidal ideation? Tell me your thought, but this is much more compassionately worded and less clinical. Describe to me any thoughts you may have had about hurting others. Do you have any history of combative, violent, and/or assaultive behavior? Sometimes people say when I'm under the influence. Have you ever driven a motor vehicle after consuming alcohol and other mind-altering substances? How many times? How often does it concern you? Have you been arrested for it? If yes, how many times? What was your BAC? How impaired did you feel at the time of the arrest? This can be attributed to tolerance. What were the circumstances and how do you feel about that now? For example, it is not uncommon for somebody to have allergies and take a Benadryl or an antihistamine and then be at a barbecue and have a couple beers and then get a BAC that's a .04. They get arrested and pulled over because they're swerving. So they're not legally intoxicated. But because they've had an antihistamine, which makes you tired, with the alcohol effects, they get pulled over for driving drunk. So that does happen. So we want to know the details of this for sure. Here's another criteria. Have you ever done anything while under the influence of alcohol or other drugs that you later regretted? Another criteria. How much time do you spend on average in a typical week in activities necessary to obtain, use, or recover from the effects of using alcohol and other drugs? So spending time at bars, crack houses, seeking out dealers, recovering from hangovers, etc. I actually tally up the number because when you tally it up and it's like, oh, I'm a binge drinker, but I drink 3 days a week, but I'm actually spending 40 hours a week using it, recovering from it, buying it. That's a lot. That's a full-time job. Okay. So math can be very enlightening. Okay, another criteria. Have you ever given up or reduced important social, occupational, or recreational activities like birthdays, graduations, holidays because of using alcohol or other drugs? Okay, and then how do you feel about it now? Gambling assessment. And you also might have a gambling screening. Usually before an assessment, the client is going to come in and fill out a bunch of paperwork with screening tools. And usually there is a gambling screening tool in there as well. Cognitive conditions and complications. Have you continued to use alcohol or other drugs despite having identified problems that were caused or made worse of it? Have you ever been diagnosed with a cognitive disorder? So there we go. Do you have difficulty understanding written materials in English? Do you need help to understand? So this isn't mental health. This is cognitive, refers to thinking, processing, etc. Okay. Then over here we have mental health. Have you had a significant period of time that was not a direct result of drug or alcohol use in which you've experienced any of the following? Is there mental illness in your family? Have you ever been diagnosed with a mental health disorder? Have you historically or are you currently receiving mental health counseling? Are you currently or have you ever used prescribed medications for mental health purposes? Are you currently taking any drugs for mental health purposes that are not prescribed for you? Legal or illegal? How would you describe your current mental health? And then your, as the clinician's, observation of their mental health, and then your observation of their ability to perform living skills. Like, how are they presenting to you? What is the affect? Are they dressed appropriately for the weather? Are they oriented to time and place? There. And then here we have our risk rating and our level of care. Okay. Great. So from no mental health problems or from severe psychiatric symptomology. Okay, and then we have our spectrum of care here. And again, we put everything in here and then individual needs. Okay, now it is important to note that if you are an SUDP and that's the only credential you have, you legally can't say, I think that you have bipolar disorder. You can say, based off of the results of the assessment, it appears that it might be a good idea for you to have a mental health evaluation. Are you open to that? Okay. So that goes into scope of practice. However, if you are a mental health professional and you have that credential and criteria, then you could um, phrase it a little bit differently. But that's just important to note there. Okay, so now we're on to dimension 4, which is readiness to change. And here is where we talk about the stages to change. So if they've been to treatment before, then you put the whole history here. Sometimes you need more lines. Why are you here today? Family pressure, physician intervention, self-motivated legal pressure, child custody, employer intervention, DUI, reinstate driving privileges, other reasons. Okay. Criteria. Do you believe you currently have a problem with the use of alcohol or drugs? Do you believe you've had a problem with the use of alcohol or drugs in the past? Have you ever felt you should cut down or control your substance use? If yes, why? Have you ever tried to cut down or control your use but have been unsuccessful? How many times? What substances? So again, the stars are the criteria. How have family, children, friends, employees, and or partners expressed their concerns about your chemical use? Tell me about any interventions, to include legal, that have been attempted to help you with your chemical use abuse. And you want to use quotes here. So intervention means tool or methodology. It doesn't necessarily mean I had an intervention where people sat me down and read letters. It could, but this is going to mean, what past treatments have you had, etc. How would you assess or describe your overall use of drugs? So here's where you want, what do you think about your use of drugs? And one of the things that I like to ask too is, what is your intention? What is the role that the substance played in your life? And when did that role change? How has the substance been helpful to you? How has the substance been harmful to you? Okay. And then you're going to put down, are you seeing any of these things? Minimizing, rationalizing, excuses, blaming, complying, other, or maybe not. Legal issues. Are you ordered by a civil or criminal court to receive treatment? Sometimes the answer is yes. Are you under supervision of the Department of Corrections? Okay. Have you ever been arrested or charged with any crime? Arrest history, and then here we have it. Okay. Disposition means, what came out of it. And sometimes we have to add more lines. Have you ever been in jail and or prison? Are there any current charges pending? Are you in drug court? So here is where we look at the stages of change. It is worded a little funky. Would you like to reduce or quit drinking if you could do so easily? So sometimes you have a person that's getting an assessment, but it's very clear that they don't have a substance problem. So if they're answering honestly, it could look like they're being defensive, but they're not. Well, I really don't have a problem. And that does happen. So please don't become jaded or suspicious of your clients. Sometimes people do lie. Sometimes we do catch them in that. But there are people that maybe they had a DUI, like the barbecue situation, or they got caught using marijuana once in high school, or I've had people that, they ate a laced brownie. They didn't know that it was laced with something, and then they get a UA at work. So that type of stuff does happen when you are assessing people. Listen to the client. If something doesn't sit right in your gut, then explore it further. But this is a highly intuitive field. So just be aware of how answering these can kind of look. And then you're going to put the patient appears to be in what stage of change? Pre-contemplation, contemplation, preparation, action, or maintenance. Okay, and then same thing. We have our risk ratings here. And our level of care, we put in the summary of the dimension, and then what do they need. Dimension 5, I like to do this first because it takes a long time sometimes to go through the entire use history, because what we're doing is we're saying, okay, how old were you the first time you used alcohol? How long did you use it? When was the last time you used it? In the last month, with any 12-month period, how often were you using it? Okay. The administration code is how are you using it orally? Okay, and then PST, is it your primary substance, the secondary substance, or your third substance? So basically, what is your preference? What do you go to first? And then here's where it can take a long time. History of use, including last 3-year use pattern. So we're basically doing this in 3-year increments. So if you started using alcohol at 16, what was your alcohol use like from 16 to 18 or 19, with the exception of whenever it went up or down, or you changed substances, or you changed how you were taking it. Okay. So we do this for every single substance, everything: alcohol, amphetamines, barbiturates, benzos, cocaine, hallucinogens, heroin, inhalants, major tranquilizers, marijuana and cannabis, nicotine, other opiates and synthetics, other sedatives or hypnotics, PCP, prescribed opiate substitute, so that would be methadone, Suboxone, etc., over the counter, and prescription medications. Okay. Also, supplements. So a lot of the bodybuilding supplements have huge amounts of caffeine in them, so I want to know about that. Sometimes caffeine is actually on here as a category by itself as well. So I like to do this first when people are kind of refreshed in the beginning of the semester, or sorry, in the beginning of the session, because by the time we get here, people are tired. So I like to do this first. And here we have a detailed history of relapse. So here, we have more criteria. Have you ever attempted to discontinue your use of alcohol? And then we have the same for drugs. What's the longest you've abstained? Did you resume using, and how did it make you feel? Have you ever experienced cravings to use alcohol or drugs? If yes, what are the thoughts? So we know that that's a criteria. And then what is your assessment of their ability to attain and maintain abstinence, and why? Everything has to be backed up by evidence, and so that's a good time to put in client quotes. What is the risk for relapse? And then what's the potential for continued use? So we want in things like how risky is their use? How bad are the cravings? What are they doing to get the drug? Are they using needles, etc.? And then we have our risk ratings here as well, and our summary and our needs. And then dimension 6 is the last dimension, and that's the recovery environment. So this is everything else. What jobs have you had in the last year? What's your primary occupation? Last time you had full-time employment, and if unemployed, why? Now here, again, this is a drug court form, and I want you to look at all of these choices. Which one was your major or largest source of support during the past month? None, a job, spouse or partner, family or friends, unemployment, public assistance like food stamps, SSI, prostitution, illegal activity, selling, distributing, or manufacturing drugs, gambling, or other. So again, population specific. Which of the following employment problems have you experienced due to alcohol or drug use? Late for work, diminished productivity, absenteeism, quit, fired, used at work, etc. And then what substances? Do you currently identify with any organized religions? Were you raised in an organized religion? Do you consider yourself to be a spiritual person? Sometimes we have to have a conversation about what's the difference between spirituality and religion. Do you identify yourself with any particular cultural, ethnic background, or community? Is there a particular form of support from this community that you can use for your recovery? Are there barriers to accessing treatment? So for example, I don't have childcare, I'm homeless. If I go to treatment, I'm worried my kids are going to be taken away, very common fear. Have you ever been involved with self-help groups? No, yes, past or current. How do you feel about them? Which group? Are you willing to attend them now? And then which type? And then we might need to do some education here as well, because there are so many different types, but 12-step is most popular. So most people might not be aware of the other options. They're becoming more publicized, but that's a good opportunity for education. And family history of chemical dependency. And then we have room for comments. Is your family supportive of abstinence? Are your friends supportive? Spouse or partner? Are your living arrangements supportive? And do you live on top of the bar? Funds for basic needs, employment opportunities, safe environment in home or neighborhood. Describe how it might be unsafe to return to your previous home. So for example, if you're couch surfing at your drug dealer's house, that might be unsafe for you. And again, we have our risk ratings here, and then our level of care. And our summary. Never leave this link, very important. And now we have our diagnostic statement. So you have to go back up and figure out what's the primary drug of choice. And so then you rate each one individually primary, secondary, tertiary. There might only be one, there might be two, there might be three. So remember that 2 to 3 criteria is a mild problem, 4 to 5 is moderate, and then 6 or more is severe. And sometimes people do have all 11. Sometimes people don't have any, and then we can say that there's not a significant problem. Okay. So then we want to put what substance it is, right? Okay. And then here are our codes. Denied use, mild alcohol, moderate, maybe the denied use of other substances. Very common just to have alcohol only. And this is for, we're diagnosing based off of the last 12 months, so a calendar year. So it's entirely possible somebody might have had an amphetamine problem 20 years ago, and then they have an alcohol problem now. That happens all the time. So the codes are going to differ based off of what it is, if it's mild use, moderate use. So look at those numbers there, that's important. Okay. And down here, this is possible to get the screening of substance use revealed insufficient symptoms to indicate diagnosis. And then you go back and look at the dimensions, and then you put in each level of care. Is it 0.5? Is it 3.5? And they don't all have to match, but you do have to kind of have a median or a majority here. So you can't say like one dimension is inpatient and you're like, well, they have to go to inpatient. That's not going to fly. Some agencies want you to have about 3 that match, but what's really important is to look at the relationships between the dimensions, especially the relationships between dimension 3, 4, and 5. And then 6 kind of rounds things out a little bit. Sometimes this happens too. Are there any circumstances that would justify an override of the ASAM criteria clinical recommendation? So for example, you go to treatment or you go to prison. Logistical barriers or lack of available services. Sometimes a patient might be on the border of going to intensive outpatient and going to inpatient. ASAM tells us to put people in the least restrictive level of care for which they can be successful. However, you might have someone that says, I really want to go back to inpatient. It helped last time. I need to get away. I need to get my housing sorted out. And if they ask and it's not too big of a stretch, then you can check this. Okay. And sometimes it's the other way around too. Like, I really can't go to inpatient. Can we try intensive outpatient? Okay. Did you tell the individual? This should always be yes. They should know what their diagnosis is. Was the individual provided with treatment and referral options? Were they referred to a gambling treatment provider? Yes, no, or NA. And then are there other recommendations here? DV, perpetrator program, mental health counseling, literacy or tutoring, anger management, vocational rehabilitation, self-support groups, GED, or other. Does the individual need part-time or around-the-clock childcare in order to access treatment? Does the individual need help accessing or selecting childcare? And did you have referral information for childcare? So then they sign it, and then you sign it. And then they don't have to accept the results of your assessment. They can go to other agencies, and that's not uncommon either. And sometimes what happens is a person will go to a couple different agencies, get an assessment, and then call you and say, I revoke my release of information so that you can't, especially if it's court ordered, tell the judge what you saw. They can completely do that. That's within their right to do that. And generally it's because they don't want to do a lot of time. So if you do an assessment and it's like, okay, well, you need a year of treatment, intensive outpatient to outpatient, and then they go to somewhere else and they're like, oh, you just do 6 months, then they might just take the 6 months and just have that sent to the judge. Okay. And then you print and sign. Now, sometimes the assessment has to be updated. If they used again, you update the use dates. Sometimes that happens. Right. All right. And then this is just for DUI offenders. Not all assessments have this. Again, it kind of depends on the assessment form and the primary population that they are serving. So I hope that this was helpful. We will be doing an assessment in class. Thank you for watching.